Charlotte, can you hear me now?
I can hear you. Can you hear me?
Wonderful. I can.
Great. All right.
I apologize, everybody. This is Topher Buck from the IC2, of course. I guess it wouldn't be a webinar if we didn't have at least one technical issue, and somehow I was unable to unmute myself. I apologize for leaving you hanging there for a bit, but thank you very, very much for joining today's webinar on Healthy Babies' Bright Futures. I'm just going to do some very quick housekeeping here, and then I'll introduce Charlotte, Brody, and we'll get started. So I first of all want to mention that we are recording the webinar so that we can make it available later to folks who are interested but were unable to attend today. Of course, as I'm sure you expect, all attendee lines are muted during the presentation just to cut down on extraneous noise. I don't expect to have a really large, we're not going to have dozens or hundreds of people on today's webinar. I will plan to unmute your lines, at least to the extent that I can. Some of you may have muted them yourselves. But when we get to the Q&A, so that we can have some discussion and you can all ask questions of Charlotte in your own voices and words. We are, of course, going to leave time for Q&A toward the end of the presentation, 10, 15 minutes, I think. So looking forward to that. If you're having issues, either technical issues during the broadcast or for some reason you either can't unmute yourself or don't want to and want to submit questions via the chat feature, you may certainly do that. Let's see. Oh, and as always, I will post the slides for today's webinar on the IC2 website, within the next week or so. Finally, I just want to remind you that we really value your feedback on these webinars, and you should have the option to take a survey through GoToWebinar when you exit, and I would ask you please to do that, to give us your feedback on the webinars. So to introduce Charlotte, we're really happy to have Charlotte Brody today talking to us about Healthy Babies Bright Futures. Charlotte is the National Director for Healthy Babies Bright Futures, which I'm not going to introduce because she will. But let me just say, for those of you that don't know Charlotte, in addition to her work on Healthy Babies Bright Futures, she's the Vice President of Health Initiatives for the Blue Green Alliance. a partnership of America's largest labor unions and its most influential environmental organizations to identify ways today's environmental challenges can create and maintain quality jobs and build a stronger, fairer economy. Charlotte has a long career of work in this field with a number of prominent organizations. I'm not going to take the time to name them all right now, but you've probably seen her bio in some of the emails that I've been sending around. And again, we're really thrilled to have Charlotte here today. So Charlotte, please take it away.
Thank you, Topher. Can everybody hear me? At least, Topher, can you hear me? Nobody else can respond, but.
I can certainly hear you. And
okay,
again, if people are having issues, please chat, send me a chat to let me know. But yes, I think, Charlotte, we can assume that you can go ahead. Thank you.
Great. So I want to talk to you about Healthy Babies, Bright Futures, and I want to begin by talking to you about what we're doing in the ways that we've learned to talk about it. And it would be really good if I could make my, there. So the next few slides come from the communications research that Healthy Babies, Bright Futures did before we launched. And this is part of our larger sense that one way that Healthy Babies, Bright Futures can add value to the field is to really devote more time, energy, and resources to communications. And the next few slides are the result of the first round of communications efforts. And so they start with a factoid that you probably all know, but that turns out to be very important in the way we tell the story, that we don't have the kind of regulatory framework that people imagine we do have, and that we are all vulnerable to chemicals that are untested and unregulated in the products and air, water, and food we use every day. And that specifically, that lack of regulation and information impacts our most vulnerable population, babies in utero and in the first 2 years after they're born. And that these are chemicals that are all around us, and that we find these chemicals in the bodies of most pregnant women. And the result, among many other things, is that IQ points are being lost, that and that it's moving the curve away from talented and gifted to kids with learning disabilities. And that these chemicals are creating a silent epidemic that doctors and research scientists see is having a dramatic impact on children's ability to learn and thrive. And that anything we do to limit exposures to these chemicals is value added, that higher exposures lead to higher incidence, and lowering those exposures, while we're not saying that these are the only cause of these problems, lower exposures to these toxic chemicals will create a decreased incidence of ADHD, autism, behavior problems, cognitive delays, and low birth weight. And then that it's important to talk about how prevalent these problems are, and that especially for autism, but for other neurodevelopmental problems, they're getting worse. And that there's no way you can explain all of this as a difference in diagnostic criteria. So why do I start talking about the problem in that way? It's because of the work that we did last summer with the PRIME group. And this is one of the slides. I'm happy to share the PRIME group findings with anybody that's interested, but this is, of the things we learned, I thought this was one of the most interesting set of values about where is the concern strongest. Like every other poll we've ever gotten to do, women care more about this than men. Hispanic and African American communities care more about this than Caucasians. Parents care about this more than non-parents, and the Northeast is the center of concern for this kind of issues. This is a second set of findings from this work we did with Prime Group that resulted from our Healthy Babies Bright Futures communications director, David Zucker, actually working with some of the leaders of the market campaigns and state groups, asking them what they thought the strongest messages were, and then testing those messages with a cross sample that was meant to be representative of the American people. And you see that some of the messages that we thought would be really great turned out to not be so great, and that these three messages that are at the top are the ones that I hope you saw reflected in the first slides that I described. And so that comms work and those findings about the data are what create the framework for Healthy Babies, Bright Futures. And we began this effort by working to build a more aligned and coordinated collaborative campaign among all of the groups who are working on flame retardants. And it's our first proof of concept that the integrated flame retardants campaign is having great success. This slide describes just one of the things that's happened. Many of you may know that just this week, the city of Boston, the city council of the city of Boston voted to change their flame retardant rules so that now in sprinklered public buildings, you won't have to use foam that has flame retardant chemicals in it, aligning it with the progress that was made first in California and then around the United States. It's a really big deal. It will matter a lot, and it comes on top of another victory this month where firefighters took the lead in changing the rules in the District of Columbia to move away from the use of two important flame retardants. We from the beginning, excuse me, wanted to design Healthy Babies, Bright Futures so that it was based on the science and data-driven and really focused on delivering measurable outcomes. And those outcomes are not, how many column inches we get in the press, but rather, or how busy we are, but rather, what can we actually do to reduce the impact of these chemicals on pregnant women and children and demonstrate the economic benefits of that reduced exposure. And doing that through really looking at the science and prioritizing interventions that show where we're going to have the greatest results in terms of dropping exposures in people and expanding the individuals and number of groups, the allies we have in this effort. So we began by asking where the science was the strongest. And this is a slide from Tracy Woodruff, who many of you may know, who used to be at the EPA and was one of the primary authors of the first Americans, Children, and the Environment, and is now at UCSF leading the program on reproductive health and the environment. But this is Tracy and her team's analysis that Ruth Hennig at the John Merck Fund commissioned, that really began the conversation that became Healthy Babies, Bright Futures. And that work and this analysis, I love it when single slides describe so much analysis of the data, and here is one that I think does a really good job of doing that. Here's what Tracy taught us we should be paying attention to in terms of what the science was saying about environmental chemical exposures and neurological disorders. And this slide from Gilbert et al., there's also a very fine version of this that you can find on our new website that is Bruce Lamphier's way of telling the story in a video. But when we talk about the drop of a few points of IQ, why this matters so much, right? That it's only a few points, and what's 2 points in you or me? But across a population, it makes a huge difference, and that we need to find really good ways of telling the story and explaining why it matters. And in Healthy Babies, Bright Futures, we're trying to tell that story in 3 different ways: Bright Choices, Science into Action, and Bright Cities. The Bright Choices is is most easily explained by describing the integrated flame retardants campaign that I talked about a few minutes ago. The idea of bringing groups together and honoring the value of each of those groups and the contribution they make, and finding ways for collaboration to be value added rather than lowest common denominator. Something that Sarah Dahl, the director of Bright Choices, has been able to do in ways that I think are really incredible, working with an extraordinary group of 26 organizations who are now figuring out how to spend money and design strategies collectively. Starting with the most toxic of flame retardants, but not ending there. Thinking about where else could an integrated campaign be value added for the individual groups and create better results, stronger decreases in exposure on the other chemicals that Healthy Babies, Bright Futures intends to work on. Phthalates in food, arsenic in rice cereal. Not clear what's going to come next. The way Bright Choices aims to work is to really think about purchasing choices and actions and aggregate individual choices so that corporations change, markets move, and figuring out where collective action can change corporate and government policies in ways that are more effective than what individual groups are doing. Bright Cities, led by Heidi Gebrocht, who is our Bright Cities director, and most recently worked for members of the Austin, Texas City Council, is getting ready to launch an effort to get cities to move away from the use of toxic chemicals towards safer alternatives, working on 10 different key action areas. And I should stay there for a second. And we hope to announce the first 3 cities that are going to become beacons, figuring out what they can do to become a bright city on or near Earth Day of 2016. So we're pretty excited about this. Science into Action, which is led by our research director, Jane Houlihan, recently the research director of Environmental Working Group, is working with Bright Cities, working with Bright Choices, working with our Leaden Homes project to really figure out how we take the science and use it to figure out the highest impact actions and how we can track the progress in those actions to reduce exposures. All of that effort, very recently, a month ago, led Healthy Babies Bright Futures to launch with a lead and water testing program. If you would have asked me a year ago if our launch would have been about lead and water, I would have been one of those many environmental health people who would have said, I think lead's sort of done. But even before Flint taught all of us that about the ongoing problem of lead, Jane Houlihan had done a terrific job of convincing the leaders of Healthy Babies Bright Futures that if we don't work on lead, the other work really isn't going to matter. And that Flint just confirmed and strengthened that finding. And so we are working with Mark Edwards, the terrific engineering professor at Virginia Tech, to do fairly sophisticated lead and water testing. And we tried to deal with the problem from the beginning of wanting this to be a really good test, 3 samples taken at different intervals, so you could really figure out if there's lead in the faucet or lead in your lines or lead coming in the service lines from the street. And that's an expensive test. And it's expensive to ship water. So the test costs $65. And we raised a little bit of money to be able to Ruth Hennig raised a little money to be able to subsidize this experiment in crowdsourced fundraising. So this is a screenshot from our website. It says that it costs us $65, but then encourages people to pay what they can and to maybe pay a little more. And I'm really pleased to be able to say that in the first 300 or so test kit orders, we averaged around $50 per test kit. So we're in a position now to be able to start saying to communities, can we send you 25 test kits for you to work with your community group, and about to pivot to that capacity, because so far so good. The tests that we're selling online are almost paying for themselves, and we have enough of a subsidy to keep doing this for a while. While the lead and water test kit is the first piece of the public launch of Healthy Babies Bright Futures, we also want to model going forward, especially because this seems so important, from the communications research that we've done in partnering individual actions that you can take in your home where the science is strong with the things we need to do together to change government policies, to change corporate policies, to reduce exposure to toxic chemicals and the damage that they're causing to babies' brains. And so coming soon to the Healthy Babies Bright Futures website, Jane Houlihan has created this very elegant, based on the data, Healthy Baby Action Planner, which will give customized reports to people of what they can do in their homes to reduce exposure to neurotoxic chemicals. And we're committed to finding additional ways to work with our partner organizations on individual and collective actions that we can take that move us towards fewer toxic chemicals in babies' brains. And our plan, our proposal, our vision is that in a 10-year time frame, we will have found the ways to protect millions of children to ensure they have the ability to prosper and to participate in productive communities. That's my slideshow.
Wonderful. Charlotte, thank you very much. So I will now go through and unmute folks. Again, you can of course choose to keep yourself muted for some reason if you want to, but in the interest of giving us an opportunity for some Q&A and discussion, I'm going to do that. So let's see, bear with me. Okay, so I've unmuted everybody that I have the ability to unmute. Not everybody not everybody has controls enabled in such a way that I can do that, but the lines for the most part are now open. So if you've got a question for Charlotte, please please speak up.
Charlotte, this is Pam Eliason at Massachusetts Toxic Use Reduction Institute. How are you?
I'm good. How are you, Pam?
I'm good, thanks. Thank you so much for showing us the work that you've been doing, and it's just it sounds like, you know, the messaging piece of it has been so well thought out, and I know that you know, that's often a real challenge for us to figure out how best to get the attention of people around these issues that we're so committed to working on. I'm curious what your thoughts are or your hopes are with respect to engaging with states or communities. I'm really interested in the Bright Cities outcome, but are there things that states might also be able to do to engage with you around messaging, around research? What do you think?
It's such a good question. You know, the only yesterday, Pam, I got asked what I thought the state's appetites would be for requiring lead blood testing for all infants, not just Medicaid infants. And I was struck by my sort of inability to answer. You know, that if I would have been asked, what did I think the states would be willing to do on disclosure of lead in products designed for infants, or it would have been easier for me to answer. But I think that having an ongoing conversation about the really important work that is going on now on disclosure of chemicals, the importance of recognizing pregnancy and even the preconception period, so that as important as it is that we're disclosing chemicals and products designed for young children, that doesn't do a good job of protecting pregnant women or women who are about to become pregnant. You know, and sort of thinking through with the states, is lead in babies testing part of what IC2, for example, thinks is on their agenda? And what does that mean once you found the lead about identifying where it comes from? Or how do we take the really good work that's been done to protect children and think about how the data that shows that really we need to be protecting women when they become pregnant or before, how does that change the way we do our state?
Yeah, thank you.
Will you answer that for me? What do you think?
Yeah, I mean, that's the challenge, right? So would that become, you know, is IC2 interested in putting that on our sort of priority list of activities? Is that what you're asking? Or
Yeah,
you're asking what I,
if somebody came to you and said,
yeah.
just thinking about Massachusetts, that is blood lead testing part of what you think TURI should be? You know, is it in your bandwidth or not? Right? Should it be in anybody else's bandwidth?
Yeah, yeah. So, you know, from TURI's perspective, no, because we're not regulatory, but that doesn't mean that it shouldn't be part of our kind of regulatory thought process. And, you know, for the state. And I think from TURI's perspective, if there were to be that kind of testing required, I think it would be really valuable to be thinking through what do we tell people? What do we tell people who are thinking about becoming pregnant if they discover they have a certain level of lead in their body? You know, what can we tell them? With respect to, you know, do you need to change products that you're exposed to? Do you need to, you know, have some sort of treatment? You know, I think that's, to me, that's kind of an interesting question. And no, I'm not going to speak for Massachusetts.
Charlotte, this is Topher. Just out of curiosity, do you know, I assume that these kinds of numbers must be generally available, how much, you know, I guess either at an individual or sort of an aggregate level, what would doing a blood test for, you know, a blood lead test cost? I mean, I'm just thinking, I know, of course, that, you know, certainly when I go to the doctor for my annual physical, you know, they're going to draw blood anyway to run a number of different things. So in theory, the incremental cost of taking some of that sample and using it for a blood test may not be really great, but it's certainly not zero. Do you have a sense for, and again, my sense is that you're primarily here talking about testing children, not adults, right?
We're talking about really testing infants.
Yeah.
Right? Because that's when the harm is greatest. The blood lead testing is very inexpensive, relatively speaking, and is my understanding, and it could be covered as part of preventive health services, which are subsidized. But the cost comes in and figuring out where the lead is coming from. Is it in paint? Is it in dust from the vinyl blinds? Is it coming from pottery and cookware? Is it coming? Recently, I learned that there are some of the red powder that's used in Hindu ceremonial practices. It used to be made out of turmeric and lime juice, and now some of it is mostly lead. So that kind of investigation to figure out, okay, there's lead in the baby, but where is the lead coming from? That's where it gets expensive.
Right, and I guess that gets very much to Pam's point about, you know, the question of being ready to answer the questions that would follow from the results of the test.
Right.
So, Saskia, I know you had a question, and I think you have been, I think you're unmuted. So, would you like to just ask your question?
And can I just say, this is Rachel Massey, and my system is still muted, so Pam just let me use her phone for a minute. But maybe if you could recheck the mute settings.
Sure. Rachel, do you want to just ask your question right now?
Sure.
Go ahead. That's fine. I don't think.
Okay, thank you. So Charlotte, thank you so much for this great presentation. And the thing that I wanted to ask about is I've been thinking about the Zika virus, and I've been wondering a couple of things. One is, does this create a new opportunity for us to educate people about prenatal threats, because it's just showing up so much in the media, and maybe there's a greater willingness in the media to talk about a threat that comes from a virus as compared to a threat that comes from a chemical. And also, I'm wondering whether there's a need for states and advocacy groups that are normally focused on chemicals to do some advocacy around Zika as well, because it's a disease of poverty, and we're likely to potentially start seeing babies with microcephaly in underserved communities simply because they don't have things like trash pickup and screens in their windows. So it's a bit outside our kind of the set of things we're normally looking at, but the impacts are accruing in the same ways. So anyway, just wondered if you had thought about kind of how to work with that at all.
Well, Healthy Babies Bright Futures hasn't had a Zika conversation, but I can say to you that I've been really concerned about the way Zika is being talked about, and about
so please let me know.
the need to have a much more content data-driven conversation than the ones that we've read about in the press, right? And to make sure that we don't decide that the solution to Zika is to go back to the Jones Beach photograph of spraying DDT down every street in America and on every beach, right? Microencephaly is an incredible tragedy, and it's I think, Rachel, you and I are looking at the press the same way and thinking this could be really bad, and we could address this in ways that don't do much for people who get severe cases of Zika, but could be really bad in a whole lot of other ways. So
And I guess just also it seems like an opportunity to talk with people about the ways in which prenatal exposures affect babies and children, which sometimes is very hard to get anybody to talk about.
Yep, I think that one of the things that's coming down the pike soon is an extraordinary consensus statement from a well-regarded and large group of scientists on the impacts of neurotoxic chemicals on the development of babies. And one of the real bright lights is that ACOG, the American College of Obstetrics and Gynecology, is a signatory to that statement. So it really is going to be a good time for us to have that kind of conversation. And I think, let me say, as one of the people who worked on children's environmental health, that I always felt, that we were ignoring the data on prenatal exposures and acting as if, just to your point, Rachel, about we were just not addressing the part about these problems beginning preconception and during pregnancy, and just not talking about that part. And that we want to address that with Healthy Babies, Bright Futures. We worked really hard with our our website designers who first wanted it to just have only pictures of babies because they're so cute and multicultural, and to really get them to replace some of those pictures with pictures of pregnant women.
Great, thank you.
Yes. So Saskia, I think, again, if you want to
Sure.
ask your question directly, go ahead. Thanks.
Thank you, Charlotte. And so, question about the cities. You mentioned that 3 of them are going to be announced soon. But I was curious if all the cities have been determined, and if not, how the cities are being identified and recruited.
No, we had a great design charrette for how to do Bright Cities in Seattle, and there were people from 10 cities and counties there helping us design the program. They haven't all been chosen at all. These are just the cities that are sort of ready to go, chomping at the bit. And so, you know, we want to take advantage of that opportunity. But the idea is for us to have 10 cities working on figuring out what are the most effective things they could be doing in 2016, and then going from there.
Great. So there's one question that's come in through the chat, just because, so this is a question from Joanna Malachinsky, is in a location where there's some background noise. So she's submitting a question. The question is, Charlotte, are there efforts to do home assessments or some sort of environmental health assessments in homes, communities, et cetera, to help individuals identify sources of potential toxins in their lives?
Oh, what a good question. So we're just about to launch our first piece of answering that question in doing a 500-person in 10 locales lead in homes testing project. And you know, unlike our lead and water project, this will really be about soil, dust, water, paint, products, and really trying to figure out with 500 families in 10 places in the United States where lead is coming from, if any place, and then take what we learn from that 1-year citizen science experiment and to find the other sources. You know, there's some really pretty good data about the difference that wet mopping makes for not just for lead but for a host of neurotoxic chemicals. There's some pretty good data about the difference that taking off your shoes can make in walking PAHs and pesticides into your house. But in some ways, we just don't know very much about what's going on and what we can do to reduce exposure. So we have the money to do this first 500 family experiment. I had this really interesting conversation with Earth Justice a couple of weeks ago about lead in aviation fuel, that they think that there's some early evidence means that if you live near an airport, your soil is more contaminated than if you live somewhere else. We're going to try to figure out if that's true as one, you know, in sort of a preliminary citizen science way. But we aim for that to be sort of step one in understanding much more about what we can say to people about where what exposures they have, where they're coming from, and what they can do about it. And to be, and you know, this is where we could use all the advice people have about, you know, if the science, we really want to be data-driven. So if the science shows that wet mopping makes a difference, we want to say that. But we also sort of want to create, you know, a country of angry wet moppers who understand that we shouldn't have toxic chemicals coming in the dust, right? That we need to change policies at the state level, at the city level, at the federal level, so that there's just less toxics to worry about.
Great. Charlotte, this is Kevin Masterson from the state of Oregon, and just a little bit of a follow-up on that question related to localized point sources of lead and other types of pollution. Is that going to be part of the Bright Cities program? Because there's still, as we're learning in Portland, there's some smaller point sources that haven't really even been discovered yet by regulatory authorities that may be causing some problems in certain neighborhoods. And how would the cities get involved in that? How would your organization get involved in helping to identify those and working either to change policies or collaboratively with businesses to make a difference?
Right.
I guess it's kind of an
it's
environmental
such an important
justice issue.
Yeah. You know, the general idea is that a city first assesses what sources they have and which are more important than others. I mean, obviously, you know, a city that has a lot of, where all the schools still have light fixtures that were put in the 1970s is going to have a PCB problem that another city isn't going to have, right? A city that's getting its power from a coal-fired power plant is going to have a problem that another city isn't going to have. And so the assessment tool that we're developing first as an Excel spreadsheet, and then we aim to have it customized on the website so that it takes you to the information that is more specific about your location more readily. It's designed to take the available science and assess what are going to be the most impactful actions for your city. And you know, we really need to think through where point sources are just aren't completely known, but are just only the tip of that iceberg is visible. How do you account for that in assessing hazard? And then, you know, and then figuring out together, you know, which of these things are really truly solvable at the city level, and which of these things need the collective action of cities and others to address the source. So again, you know, we aim to do this by finding more money and figuring out better tools, but to do this in a way that's iterative and collaborative, and where everybody gets credit for the part that they're playing.
Great, thank you.
Thank you. Other questions for Charlotte? Charlotte, I have one, and it's similar in a way, I think, to Saskia's question. I mean, clearly, so much of this work, as with a lot of the work that your IC2 and you know, the organizations that make up the IC2 do, involves, you know, issues around prioritization. And so Saskia's question around, criteria and choice of cities for you to focus on, I'm curious as well about, from a process standpoint, and even just if you have a short list already of the chemicals or classes of chemicals. I mean, obviously we've talked quite a bit about lead. You've talked about flame retardants. We keep hearing, certainly in the Northeast, in the last few weeks and months, we are hearing there's a lot of news about PFOA in groundwater in certain communities. I'm just curious if you have a. Okay, well, yeah. So is that the list that you're focused on at this point?
Well, we're starting with Tracy's list, right? So we're starting with lead, mercury, PCBs, OPs, organophosphate pesticides, PDBs, and the other flame retardants, PAHs, arsenic perchlorate, and phthalates. But not not because those are the only chemicals that matter, but we needed to start somewhere, and that's where the science is the strongest.
Great.
And then to go to the which cities, I think that our criteria there are obviously first cities that are interested in doing it, right, and have the capacity to do it. But then we move quickly to optics, right? That if it's only if it's only Seattle and Portland and San Francisco, that tells a different story than if it's Salt Lake City, Dearborn, and Cleveland. So we want to create a mix of cities that are generally thought of with good reason as being the most progressive, with other cities that don't get thought of that way, and partly because we aim to create a community, right, of those cities. And Seattle and Portland have a lot to teach Dearborn and Salt Lake City, and I bet Salt Lake City and Dearborn have a lot to teach Seattle and Portland.
Excellent point. Thank you. So I'm going to switch us. We're now just about at the end here, so I'm going to just switch back just to sort of conclude. I guess, Charlotte, do you have any concluding comments or thoughts you'd like to share?
No, only that we I'd love to talk more about point sources. Anybody who wants the communications work that we've done, those PowerPoints, should ask for them. This is really meant to be a framework for asking and answering, how do we do our work more powerfully? And I put my email on the last slide, and I'd really, you all have done so much good work. I'd love to hear any advice you have or concerns you have about how we do this better.
Well, that's great. Thank you so much, Charlotte. And again, just to remind everybody, I will post PDFs of Charlotte's slides on the IC2 website in the next few days. So, if you're looking for those, looking for Charlotte's email, you can find them there. So thank you again very much, Charlotte. Really appreciate it.
Welcome. Thank you.
Just again to remind folks that the training work group, the IC2 training work group, is continuing to plan more webinars for spring 2016. We are, of course, always interested in hearing your suggestions. So if you have an idea for a webinar, a presenter, a topic, please get in touch with me or Kevin, who's the chair of the training work group, or any of the work group members. We'd love to hear from you. And again, one last request that you please take a couple of minutes to fill out the survey at the end of the webinar through GoToWebinar to give us your feedback. Thank you all very much for attending, and thank you again, Charlotte, for taking the time to present to us today.
Thank you.
All right. That concludes the webinar. Thank you, everyone.
Bye-bye.
Bye-bye.